be here. I will email her while we do our introductions, just to double check.
Awesome. All right. So I think we'll call the meeting to order. This is my first meeting as a co-chair. Hayden, have you led a meeting before?
Not officially, I don't think. I've helped out.
Terrific. So we're both a bit new to this, but I think we'll get the hang of it. But just bear with us and coach us through if we make any errors along the way. But we will call the meeting to order. And you've all received a copy of the agenda. Are there any items here that folks would like to add?
I guess just in advance of the agenda, just in terms of familiarity with online fully remote meetings, for all participants who are attending virtually, if you want to comment on any part of it, you can raise your hand, or there's a Q&A portion, we can answer questions that way. And I have the ability to mute and unmute people, so if anyone's noticing any background noise, I can go ahead and mute and unmute as needed. But apart from that, nothing else, Isaac, just wanted to add.
Terrific. So I will just defer to the previous co-chairs. Do we need to make a motion to adopt the agenda?
Yes.
Yeah,
Okay, terrific.
So moved.
Thank you,
seconded.
Shelley.
All in
All right.
favor?
All in favor?
Aye.
Aye.
All right. Terrific. So the agenda is adopted. And the first item that we have on the agenda is the introduction to the new co-chairs, myself and Hayden. And because I'm speaking already, I guess I'll begin and then pass it off to Hayden. My name is Isaac Adlerstein. I've met with many of you privately already, and I've lived on the Upper West Side for the last 4 years. I serve as the executive director of a homeless service agency called Broadway Community on 114th and Broadway. So a tiny bit north of Community Board 7. And I really see human service work as my life's calling. My grandparents live on the Upper West Side. I've been coming here my whole life prior to me moving. And I'm very eager to see us make our community a better place for everyone. So that said, I'll pass it on to Hayden.
Hi, everybody. I'm Hayden, and I think you all know me. I am an attorney by trade, and lived on the Upper West Side for, gosh, let's see, coming on 6-7 years now. I'm excited to continue in the great tradition of all the folks who have been on board, including by trying to keep us on time. So I'm going to move us along through our community happenings, and off of me and onto community happenings. And I'll try and make I was going to take the beginning of that. And, I want this to be a discussion, but Isaac and I prepared some notes about where we are. So the first item on the agenda, obviously, was going to be an introduction of the local food security organization, but I think we'll need to defer that. And I know Laurel had sent a presentation. I would love to hear from her. So I think we'll move on.
I think Laurel actually has her hand raised.
Oh, I'm sorry.
Indeed, if we're able to elevate her, that'd be terrific. Laurel Bishop.
Yes, I just see Laurel. I'm promoting you to panelist.
Can you hear me?
Yes.
We can hear you.
Okay, and let me see if I can turn on my video. Start video. Okay. It doesn't seem to be doing it. Oh, there we go.
Do you have a laptop?
Okay.
Oh, there you go.
Yeah.
Now I can see you.
Yeah, I've never used this Zoom Workplace before. So all right. So do you have the presentation? Hayden, how do you want me to do this?
I do, and I'm pulling it up. It says the browser is preventing me from sharing my screen. Forgive me.
Is it Safari?
I can share mine. I see the share if you want.
It's Firefox. Yeah, if you can, Laurel, sorry.
Yeah, I can do that. Let me get right over here. Share.
Perfect.
Can you all see it?
Yes.
Okay, let me just move that over because that's kind of in my way. So I'm from St. Ignatius of Antioch. We're on West End and 87th. Hayden is also a member of the church. And we have basically three programs, outreach programs. The oldest running one and the one we really focus on is our soup kitchen that we serve about 60 people every week on between Saturday evenings and Monday evenings. We also support a mother and child weekend retreat in collaboration with a nonprofit that supports single parent families. So that happens once a year. And then we also have established a relationship with the Homeward shelter on West End and 83rd. So besides delivering food as part of the soup kitchen to some of their elderly residents, we also support a monthly program they have again for their elderly residents called Soup and Song. And we go all out for the holidays. So they have a meal that holiday meal they provide for all 200 residents. So we go there, we provide desserts, we help set up, serve, pack things for the shut-ins, and then we also give gifts. Usually it's for the moms because they have donors that provide gifts for the children. So it's really the moms that really appreciate gifts. So those are the three, the programs that we. Let me see how I can do this. Sorry. Oh, there we go. Okay, so what we need in terms of the soup kitchen, it's really volunteers because we have enough, I think, donations of food and non-food supplies through New York City and Episcopal Charities, but we need people, particularly backups for Monday evenings, and we are short a captain for the 5th Saturday of every month. So if anybody would like to do that, it's a big ask, but that is a big gap for us right now. In terms of the Homeward shelter, we would love to have volunteers from the community help us on the once a month evening. They bring all the elderly residents together for, just as it says, soup and music. And I've given the dates, the next dates, and there's a sign-up sheet. We work in collaboration with a grassroots organization and on the Upper West Side for that. In terms of donations, of course, we could always use cash for the soup kitchen for the things that we can't get from the bulk vendors, but travel-size toiletries are always welcome by our guests to the soup kitchen. Many of the people we serve, do live in the park and have very limited means. The shelter would love diapers, and they actually very specific sizes 4, 5, 6 wipes for them. So it is difficult. You would need to contact me so that I can arrange drop off. They have security at the shelter, so you can't just walk in and leave things, and our church isn't open all the time. So that's the logistics can, I can handle it. If folks wanted to donate, they could contact me.
Great. Thank you so much, Laurel. Your email is L.A. Bishop
Green Dyke. I know my husband, my name.
Email.com. Great. And we can put that in the chat.
Lovely.
Any questions from the board members or the public? Well,
could you repeat your email again?
It's L.A. Bishop, Green Dyke. Green Dyke as in the color green, DYKE @gmail.
Hayden, we don't have a chat.
I know.
We only have a Q&A because during the pandemic, people abused the chat.
Makes sense.
So just for the information of those who may not know about the Homeward shelter on 83rd, could you describe it?
Yes, it's an intergenerational shelter, which is, I think, really interesting. They have about we have 200 residents, 54 moms with children from newborn to 5. And then there's about 40 elderly residents, and those people live there permanently. Many of them came from traumatic backgrounds. It started really as an LGBTQ support organization. So some of those people from that community that, were kind of left with nothing in the later stages of their lives. So yeah, so the elderly residents provide kind of a grandparent presence for the children. But the average age of the children is very young. It's usually around 22 months, so it's a lot of babies.
I know it's been very successful over the years.
They're
kept-
lovely.
And kept that model,
Yeah.
including the older people serving as surrogate grandparents to a certain degree.
Exactly. Yeah. They're very cute. They wait for us on Saturdays when we deliver the sandwiches and soup for them.
Mhm.
Wonderful.
I just want
Anything
to
else?
clarify, it's HTTPS Yoga Cherry.
Yeah, so that for the soup and song, like I said, it's a grassroots organization, the Mom Squad, and that's her site, the woman that pulled all these women together, and they do various things. But for the shelter, this is the one that they could really use help, either people to just come and be a host or provide music, sing, bring an instrument, make soup.
Wonderful. Thank you so much, Laurel. Feel free to contact me or Isaac, and we can put you in touch with Laurel if you didn't get all the information.
Thank you so much for allowing me to share this. Have a wonderful evening.
You too.
Thank you.
Thank you so
You
much,
too.
Laurel.
Thank you very much.
All right.
Bye, everyone.
Bye-bye. Moving on to our local news updates. The first thing was the New York NYSNA nurses who are still on strike at Mount Sinai. There is still I have not heard any news that there is an overall contract settlement on staffing and wages. I was by there today. Folks were not out in the freezing cold, but it is obviously going to there is an ongoing strain at Mount Sinai Morningside and Mount Sinai West for the emergency departments and inpatient units. There's going to be some heavier reliance on agency staff and potential effects of like wait time, continuity of care, and surge capacity. Obviously, a lot of politicians have been out there, so it's something to keep on our radar. We were going to talk about the HOPE count today, which is the Homeless Outreach Population Estimate. Many folks are familiar. It was a news to me. It was actually scheduled to be this evening, but it has been moved until February 3rd, weather permitting. That is the count, for all those who are not familiar, is an opportunity for everyone in the city who is not experiencing homelessness to be counted. Thousands of volunteers every HOPE count go out in small teams across all 5 boroughs, and they use a standardized survey and a mobile app to canvass about 1,600 specific mapped areas. And then there's professional outreach workers who accompany folks. February 3rd is the backup date. You can register at nyc.gov/hope. And that will be happening in our district, like I said, next week.
Can you tell us what time it begins?
I believe it's 10 p.m. to 4 a.m.
Correct. So people should know you're not going to get much sleep, but
That's a key point. Yep. Thanks, Shelley. We are experiencing a slight lull in that it's past its peak when it comes to flu, COVID, and RSV cases. COVID is stable as a low share of visits. Flu is on the decrease. RSV is also declining. But of course, those who are eligible for all of those shots in eligible groups, we encourage folks to go ahead and get those if you haven't already. I'm mindful of the time here. So moving on to sort of state news, we obviously had a $2.4 billion freeze in the New York State Health and Human Services funding from the federal sources. Childcare and Childcare and Development Fund, CCDF subsidies, TANF cash assistance, Social Security block, Social Services block grants were all on the chopping block. There was a $2.4 billion that was cut and paused. There was a suit by Letitia James arguing that this was political retaliation. And unfortunately, Isaac and I are not aware of any resolution of this. It's still sort of tied up in court. I did see today that there was a reversal of different cuts concerning the HHS announcement that it was pausing grants about $5 billion that were related to the CDC's 5-year plan to help with the modernization of workforces, diversity, health equity programs when it comes to monitoring for diseases. That was one of those situations where the cuts were announced, there was an outcry, and they immediately reversed them. So this, as we all know, is happening frequently, where maybe the chaos is sort of part of the point. In some really positive news, however, we had as we saw since our last meetings, we saw that the city and state, Governor Hochul and Mayor Mamdani, jointly announced that there would be a 2Care program. It's started. It's a proposal that covers 60,000 2-year-olds citywide. It's about $1.3 billion at scale if around 60% of the families enroll. There's a target for affordability and equity care for the 2-year-olds averages about $23,000 in New York City, and only about 20% of eligible toddlers currently receive subsidies. And so there are big gaps, particularly in childcare deserts around the city. This 2Care program would be modeled on the universal pre-K and 3K. And I think we may have seen some signs on the NYC link that were encouraging people to join up for 3K. But it's still, the 2K program has not actually rolled out completely. And it's sort of a beginning of the program, not a completion. I know that I have seen that certain groups have said, well, this is a great first start, but we need full funding. And I think we can probably expect to see that there will be hopefully a continued push in Albany to get full funding. All right, I've got 2 more minutes here. And Isaac, I believe you are going to be handling the federal matters. Is that right?
Sure. I'm
right,
happy
great.
to take those. So the first major federal development that it's worthwhile for us to speak about, of course, there are many, many, but the 2 that we have zeroed in on for this meeting are the Affordable Care Act subsidies. So as we all know, the ACA subsidies that made marketplace coverage a lot more affordable from COVID until the end of last year expired on December 31st of 2025. So 2026 plans are being priced under the older and more expensive ACA rules. And as a result, many enrollees in New York City, obviously across the country, and in our own district are seeing much higher monthly premiums and are having to move into higher deductible plans. And that's really impacting people that are near the age of retirement. So that is something for us to take note of. Last week, the House passed a bill to extend the subsidies for 3 more years, but the bill is now in the Senate, and who knows if it'll move forward from there. The other major federal development is the potential for a partial government shutdown at the end of this month, with immigration enforcement and ICE's tactics really drawing a lot of disdain across the country and on all levels of government. Many senators and members of the House are threatening a government shutdown if ICE and Department of Homeland Security are not defunded. And it's very worth it to note that unlike the last government shutdown, SNAP, Medicaid, and Social Security would be would remain, even in the case of a shutdown. They're mandatory spending. Medicaid and Social Security were unaffected the last shutdown, but SNAP, of course, was. It lapsed for about 2 weeks. And this time around, SNAP will be funded until the end of the federal government's fiscal year. That said, there may be a lot of confusion amongst people in our district and, of course, across the city, state, and country about how SNAP disbursements may be affected. So I think it's worthwhile for us to all take note that they will not be affected. That said, there is speculation that the Trump administration could continue to target SNAP by enforcing stricter work requirements and greater time limits for what are called ABOD, able-bodied adults without dependents. So all of that is something that we should keep an eye on. So the two practical things are there's no immediate SNAP cutoff on the table, but families may face confusion. And second, we need to watch for federal budget talks and see if the eligibility rules are going to be tightened. So that takes us to the end of our community happenings. Of course, a lot that we could discuss there, but we have a presenter from Bellevue Hospital's Community Advisory Board. And Nandita, if we're able to elevate her, that's Miss Karen Moore.
I
Oh,
don't
and here she
see-
is.
Oh, perfect.
She's actually in the chat. Perfect. Karen, please take it away.
Oh, you done mute.
Can you hear me? Yes,
Yes.
great. I will try to share, but I use WebEx, not Zoom, so I'm going to do share on the bottom. Let's see what happens. Did it come up?
No.
Shoot.
So when you do share, you'll see a screen that has like a preview, and if you hit share again, it should actually share the screen.
Great.
There you
Did
go.
it work?
It's
Great.
starting. Perfect.
Good.
Thank you. Today I'm here to talk about Health and Hospitals Bellevue, especially in regard to some of the funding cuts that you were talking about. I know that you don't have any I think you don't have any health and hospital facilities in your district, but just north of you, there are at least 3. And so what the Bellevue CAB is trying to do on behalf of HH Health and Hospitals Corporation is just go around to all the community boards and ask for support so that some of the funding cuts may be mitigated.
Karen,
Yes,
many of our residents use Bellevue.
great, because it's a great hospital.
It
And thank you for telling me that, so I won't be so apologetic about advocating for it. Very briefly, and I'm going to talk quickly because, it's 15 minutes. I'm going to give you a snapshot. I'm going to tell you about health and hospitals. I'm going to be specific about Bellevue. I'm going to talk about Medicaid. I'm going to talk about HR1, the big freaking beautiful bill, and its impact on Medicaid. And then with that information, just tell you why we're advocating for what we're advocating. Actually, this all boils down to we need more money. That's not a surprise, but 1 and 3 are funding mechanisms, and number 2 is directly related to, patient care. So health and hospitals, it's the largest public health system in the US. It's got 11 hospitals. It serves over 1 million patients a year. It's the 11th largest employer in New York City. With 43,000 employees. Its proposed budget hasn't been finalized for 2026 is 13.5 billion. To put it in context, the proposed city budget is 116 billion. All health and hospital is a safety net system. That means, according to the Department of Health, at least 30% of its inpatients, 35% of its outpatients rely on Medicaid. Medicare plus Medicaid, or the patients don't have health insurance. 65% of the patients who come to health and hospitals are on Medicaid or they're uninsured. In private hospitals, that's 25 to 28%. So there's a real difference. There's a annual funding shortfall that is mostly covered by state and federal supplemental payments in the city. Bellevue is the only tertiary care hospital in H&H. Her tertiary care means if you're in Coney Island Hospital and you have complicated or dire need for care, you'll get referred, you'll get transported or referred to Bellevue. It's been recognized through national guidelines in a number of categories. Everybody knows about trauma. You know, if you're in an accident, you go to Bellevue. Everybody knows about psychiatric evaluations. Lenny Briscoe said it all the time, send them to Bellevue, but they also clearly have other strengths. There's 850 patient beds. There were 500,000 encounters in 2025, of which 20% were telehealth. They had 110 ER visits. There was a big deal in our community board. I'm a former community board member. When Mount Sinai Beth Israel closed. So what happened was patient encounters and ER visits went up, although you can't say it's directly related to the closure of Beth Israel because you couldn't say, hey, you're from Beth Israel. You can't ask people, but Bellevue, just like all of HHC, Health and Hospitals takes everyone, regardless of ability to pay, insurance, immigration status, etc. So this is where Medicaid comes in. It's the single largest source of healthcare coverage in the states. The 2024 cost was $900 billion. The 2025 cost just came out. It's $911 billion. It's states administer using federal parameters. The income level for most is 138 of the percent of the federal poverty level. As you can see how that boils out. 22,000 for an individual, which is nothing in New York City. 44,000 for a family of four. That's even worse. So who's eligible for Medicaid in New York State? Traditional Medicaid, we know it's low-income kids, pregnant women, parents of dependent kids, people over 65, and people with disabilities. States have the option to do an expansion program. And I'm saying this because New York State, took up that option. So that means childless adults from 19 to 64 who are missing from traditional Medicaid are covered. New York City has about 47% of the people in New York City are on receive Medicaid. So that's the number, 4 million in New York City, and the population's 8.5 or something. Unfortunately, Medicaid, while it pays something, only reimburses about 70%. So all safety net hospitals who have a lot of Medicaid patients rely on some kind of supplemental payment, or they close. And supplemental Medicaid payments nationwide help offset the costs and make up some, but not all, of the shortfall. So the HR1, it's approximately $1 trillion reduction in healthcare funding over the next decade. Most of it's in Medicaid. It doesn't end Medicaid, it just makes it obnoxious. It restructures it in ways to reduce enrollment, reduce federal payments, reduce flexibility. You mentioned the ACA. ACA subsidiaries are also being hit, but it's on a separate track than Medicaid. And as of January 1, they weren't renewed. There are a lot of health policy groups talking about how many patients are going to be lost without the subsidies, but we don't know that yet. So the effect of the H&R, the One Big Beautiful Bill, it severely reduces the federal share. It adds a requirement of 80 hours a month of work or volunteer or study, unless you're over 65 or you have kids in the house. It reduces retroactive coverage from 60 to 30 days. So if you get on Medicaid, but you've had doctor bills that forced you to get onto Medicaid, it only covers 30 days of them. You have to recertify every 6 months instead of every year. And so essentially what happens, which has been seen is that when you increase the recertification requirements, people drop off. So that's probably one of the worst things they're doing. It reduces the Medicaid supplemental reimbursement rate. And for the expanded population, those are the adults 19 to 64 years, they have to now do some cost sharing. What's the impact in New York State or New York City? Well, they're going to fall off. Paperwork, language barriers, housing instability, etc. The Independent Budget Office of New York City says 950,000 people and 1.5 million in New York State are going to be negatively affected. There's going to be more than $1 billion increase in hospital uncompensated care because people no longer have any health insurance, even if it's Medicaid. There's about a $10 billion loss for state funding and an additional $4.5 billion in new state costs. And the spillover effects, there's estimated 76,000 jobs healthcare jobs are going to be lost and 136,000 jobs in related economic activity. So our 3 budget priorities. There's a fee-for-service upper payment limit that gets renewed every 3 years, and it's going to expire on March 31st. And it's a specific funding mechanism that covers the difference in reimbursement between Medicaid, fee-for-service, and Medicare, and what Medicare would have paid. And anyone who's on Medicare knows that doctors have no trouble taking your insurance. They're happy for the reimbursement rate because it's higher. Medicare is an entitlement program. Medicaid is a anti-poverty program. So there's less money in Medicaid because people don't like poor people. We're also asking to make permanent the telehealth parity statute. That's another 3-year program. I'm sorry, another statute that's expires after 3 years. This got started during COVID because they were so worried about the influx and people dying that they said, telehealth, yes, we'll pay you, just pay you. Look at the patient, decide what they need, and give them a drug. That came up again in 2023, and it was renewed for an additional 3 years. Now we're just asking, just make it permanent. People who wouldn't go otherwise, impaired mobility and adequate transportation, work, childcare, responsibilities to receive services. There was some questions at another community board about why should they get the same amount as doctors who have to pay rent and utilities and staff in the office. And in fact, the only people who would, well, that's a negative way to say, if you only do telehealth, this is a very nice bill for you. But the huge majority of providers do telehealth plus in office. So they're not really saving anything. In fact, they have added costs that relate to the subscription duo, whoever they're paying to do it, and for all the equipment they need for telehealth parity. It's and then the last thing is just asking for an overall increase in the Medicaid reimbursement rate for safety net hospitals, because it's really the best way to try to get parity. Bellevue probably has cash on hand for 20 days, and I'll just go up the river. Columbia Presbyterian has cash on hand for 200 days. So we would ask for, or we're advocating for, an increase in the overall reimbursement rate to the safety net hospitals to try to help make that more even. Any questions? Did I do it? Oh gosh, it was faster than I thought. Sorry, any questions?
Yeah. A few years ago, we did a resolution on Medicaid reimbursement, which I understand the governor has to bring together a group to discuss and recommend. Is that still the process? Would you know?
Sorry, I don't know.
Okay, I into it because I think that was the target area getting to the governor. Okay, before the legislature. And so I think we should look into that. The other thing is we did have a resolution last year, and I believe it's in our district needs about specifically what the CEO said, the new CEO said was the specific needs. Okay.
Yeah.
Certain.
Yeah, Shelley, I just pulled it up. I was co-chair of the committee back then, and we did do a pretty detailed resolution where we called for increased Medicaid reimbursement for health and hospitals and Bellevue in particular, and we talked about safety net hospitals, but we didn't talk about telehealth. And what I forget what your first ask was.
About the process used by the governor to approve Medicaid reimbursement rates, was that it?
No, I was, I think you had three requests for.
Yeah.
Yeah, and so you had telehealth and increased Medicaid reimbursement. And what, there was one other?
Yes, extending the fee-for-service upper payment limit. You know, we did and forwarded to your, we did a draft resolution for all the CBs to play around with if they wanted. You want me to share that, or do you want me to? Isaac,
You're more than welcome to share it, Karen.
I will try. Hold on, please.
I have it up on my screen as well.
Oh, great. So please bring it up.
Okay. And Karen, if you want to just walk us through.
Yes, sorry.
Can you increase it?
Yes.
By the way, we don't use whereases, we use the following facts were taken into consideration.
Oh,
for
fabulous.
67.
We
It's
can
much
always
less,
change that.
Much easier to read.
I was going to say as an editor, I love it.
So you
Okay.
could take the whereases out.
Okay. So it's your resolution, so that would be your taking it out. But this pretty much follows the presentation. New York City Health and Hospitals is the tertiary care hospital for the entire system, including all of Manhattan. It's a safety net hospital, which everyone's welcome. Provided care, these are just some numbers, 520,000 outpatient encounters, including 100,000 telehealth visits, 110,000 ER visits. Approximately 60% of their patients are on Medicaid, which only reimburses about 70% of the actual cost of care, leading to substantial financial pressure, as we'll say. HR1 is designed to cut more than $1 trillion in healthcare spending over the next decade, the majority from Medicaid. The continued functioning of New York City Health and Hospitals / Bellevue, in fact, all of them, is critical to all Manhattan residents because Bellevue delivers tertiary care to uninsured and Medicaid patients at a scale unmatched by the private hospitals. It carries major trauma and behavioral health responsibilities, stabilizes the city's public hospital network, and provides essential surge capacity during public health emergencies. So we're asking you for support. And specifically, we're saying we would like support so that a specific funding mechanism known as the fee-for-service upper payment limit, which provides reimbursement at the Medicare level instead of the Medicaid level, be, to more closely reflect the actual cost of care, be made permanent, that the telehealth parity law, which enables vulnerable patients to receive telehealth services, be made permanent, and that Medicare reimbursement rates for safety net providers be increased, because increasing Medicare reimbursement rates for safety net hospitals is really the best method to address disparities among hospitals and promote health equity.
Mm-hmm.
And I gave a couple of, well, we don't need, the 1 and 2 footnotes for your information. Of course, they're not needed.
Thank you so much for that, Karen. And I see Michael has his hand raised. Michael is actually a physician who works at Bellevue 1 day a week. Is that right?
Wow, Michael Cantor.
Yes.
Um,
Thanks. Yeah, I do, Archipelago. It was great hearing this. I've been there for 20 years now. What you had a couple things. A lot of these policies are federal policies,
Right.
and the city budget, goes towards H&H as well. So what are you guys doing to advocate to the city to increase funding for Bellevue? It seems to me we'd have more effect on trying to get potentially more effect on trying to get the city to increase its funding for H&H rather than try to change Medicare, national
I'm
policy.
glad you asked.
Okay.
I am glad you asked. We have a legislative outreach committee. I'm the chair of the Bellevue CAB because last year I said, hey, we need to get more support for Bellevue. So last year we went to some community boards and we did outreach to legislators, and we have our annual legislative breakfast and a lobby day. So lobby day is what Bellevue does for the state folks, and that's for the state budget. But for the city, outreach to the community boards, outreach to the electeds. So that's, saying, hey, can we meet with you? And then we say, hey, Bellevue is really great and you should do this, and we need more money. And an annual legislative breakfast. So our local city folks are very supportive of Bellevue. There's been a change in some of the electeds on our side of town. I live down the street from Bellevue, so we've already met with them to say, here's Bellevue, here's its needs, etc. And then Bellevue has something called the legislative breakfast, which we've invited all the health committees to. And so I'll send a note to Isaac and Hayden, and you all can attend. And so we're asking Mark Levine, he already said yes. Mark Levine, who refers to Bellevue as the jewel of the health and hospital system, by the way, is coming to talk about what health and hospitals can expect in regard to the city budget. So really it's developing relationships, ongoing outreach, and trying to spread the word. Is that enough? Or it's a serious question. Do you think there's something else we should be doing?
I don't know if there's something else. I'm just thinking about the resolutions, when I understand why you want to focus on those, larger policies, but it seems like, that kind of the retail grassroots, political action is probably going to be more effective in terms of getting more money for the budget.
Well,
thank you.
actually, so our state assembly person told us that they view every community board as 5,000 votes. So that's why we're trying all the community boards. So we have resolutions from 1 through 7. I'm sorry, I don't mean to presume that you'll approve something, but we have support. We have tentative support from all of the community boards we've reached out to, because the city does. I think the state is 15% and the city's 23% of the funding for Bellevue comes from the state and the city. The only reason I highlighted that one big beautiful bill and Medicaid is because the effects are gonna ripple all the way down to us, to the city. So we're showing that to the electeds to show that we really need their support, and it's going to have extremely deleterious effects on everyone.
Specifically, district needs, which goes to, you can't hear me.
Shelley,
You're breaking up.
you're
Mm.
I just want to be mindful of the time also. We would like to conclude the meeting before 8 if possible. But I see that Roberta has had her hand raised for a while, and Ken has also had his hand raised for a while. So if you could both ask your questions, maybe Roberta, share your question first, and then we'll move to Ken, and then we'll give Karen the opportunity to answer.
First of all, thank you so much for the presentation. Everyone I speak to, no matter what their age bracket is, are very concerned about their rising health insurance costs. So I'm assuming that a lot more people are going to either have no insurance or be insurance poor. So how will this increase? If you only have 20 days of money, will this increase the strain on your house on Bellevue and other city hospitals?
The CEO of Bellevue's name is Mitch Katz. He's a physician. He's really, in my opinion, great. And so his feeling is there's no reason why they are creating a strong outreach to for financial assistance to the community. H&H has two programs, healthcare payment programs. And one is called Metro Health Plus. You may have seen it with the yellow umbrellas. And that's an insurance program from, developed by H&H. So if someone walks in and doesn't have, or is in distress or strained, when you go to Bellevue, when you go to the city hospitals, that they say, oh, well, I'll take you to the business office. And what the business office does is sign you up for insurance. So even if people walk in, there's that opportunity. Then there's another program that's not a health insurance program from Bellevue that's called New York Care. And New York Care, it's not New York Cares, the volunteer organization, it's New York CARE, and that's free or low cost free or low cost care. And if you sit in Bellevue in one of their outpatient clinics, because we are also teaching people how to use Epic, MyChart, people walk in and say, is this where I get health insurance? So the approach is to be assertive in regard to signing people up to reduce the strain on the system. And that's the approach.
Thank you so much for that, Karen. And Ken, you've had your hand up for a while.
Yeah, it's not a question. It's just for the co-chairs, if we're considering a resolution tonight, and maybe we're not if we're trying to get out by 8. But I think that our resolution from last March it covers the third part of her ask on increased Medicaid reimbursement very well. And I don't see any reason why we should repeat that. So, but the other two parts, which I think are more directed to the feds, but we could do something on that.
Thank you for that, Ken. Yeah, I certainly don't think that could hurt for us to have a resolution, but I'll also defer to Hayden on his thoughts in that regard.
And so I'll sign off when you're, when the questions are answered, so you can get to whatever it, so you can begin your discussion. Any
Correct.
more questions?
Yeah, so the resolution
Sorry.
would be a great idea. My thoughts are I think the text is great. I think we've all had a chance to see it. So I'd be happy to support.
Yeah, would anyone like to move the motion to approve the resolution?
Well, I would vote against it because for the simple reason that we're repeating what we did in March for part of the resolution.
Oh, but that's a defeatist, Ken.
So from my perspective, we'll take anything. And now, is it okay if I sign off?
Sure,
So you can
please.
speak freely?
Real quick, actually, Karen, sorry. On the Q&A from our attendees, like from the community, there's
Yeah.
one question about, is 47% on Medicaid in New York City, or is it just the Upper West Side? I think it was part of the presentation.
New York City.
New York City.
But where that number came from is the Department of Health gave out numbers for Medicaid patients, specifically for New York City. So it's over 4 million, and we know that the population is 8 million. So yes, it's all of New York City. I have no idea what it is in the various community boards, although it's probably not the same, of course.
Thank you.
Anything else?
From my end. And Ken, just a clarifying point, I wouldn't by any means intend for a new resolution here to discount the work that you did in the past, of course.
And
Yeah,
before
I just
like
think
to say thank you.
it sets a I don't want to set the precedent of repeating resolutions, especially one that's not even a year old.
Yeah.
So,
Thank you for your support.
Thank you, Karen.
Thanks.
Bye.
thank you.
Ken, was it just one part that you're talking about that's repetitious?
Yeah, her third part, the third part where she's asking for increased Medicaid reimbursements. If you, I have
what-
our,
Yeah, we
What
just,
we can do is say, as we said in our previous resolution of such and such a
Exactly.
date.
Exactly. It doesn't hurt to repeat what we said.
okay, as long as we reference it and not
Sure.
repeat it. Yeah.
We could reference it, and we've often done that in the past. And it also, you know, a new resolution is something that new people are reading. So it's not just going to our elected officials, it's also something on our website that people are reading. And so it doesn't hurt to have that. And I agree with Louise that we can reference it. But in a strong way.
I just caution that I think a lot of her wording was in our previous resolution, so the co-chair should really check when you're writing the resolution and make sure, you know, we're not just repeating the wording from last year.
Right.
Thank you for that, Karen. Noted. So would anyone like to move to,
I so move.
To the resolution.
I recommend that we endorse this resolution with some modification.
Second,
But if we reference the previous resolution, we should include the language from that resolution in this resolution, because people don't go back to read a prior resolution.
Yes. I will reference it in our text that we submit to the board.
so all in favor of the resolutions?
I'm sorry, I can't find my raise hand thing.
Okay, so we got 1, 2, 3, 4, 5, 6, 7. Okay. So resolution carries, or the motion carries rather.
You have to say, you know, who was against it and who was for it.
Is anyone against it?
Was there, well, was,
Is anyone voting no?
any abstentions?
All the hands went up for it, so.
But you still have to do it. Anyone not voting for cause. So it's
Right.
whatever the number was, 0, 0, 0.
Terrific. Thank you,
She's
Roberta.
right. That's
10,
why I
0,
raised it.
It's 9000, and then the public
Thank
member
you.
is 1.
Thank you.
Alrighty. And Hayden and I will definitely get the hang of this.
You're
Yes,
doing
Shelley. See your
Yeah.
hand raised.
I couldn't communicate because of frozen, but the
Right.
fact is that what we need as much or more than the resolution is specifics of what Bellevue needs. I remember last year, when we last met with them, they told us specific equipment that they needed.
Right.
In order to effectively do their job. And those things we can advocate for in our district needs and to our local city council elected officials. So I think it's important if we had them in the resolution to check whether they were purchased, whether they got the funding, and if not, to check with Bellevue, do they still need it? Okay, and if so, what their priorities are, because that we can use for our district needs.
That's a great suggestion, Shelley.
What I didn't want to say was the CEO asked us for volunteers for the Community Advisory Board. That and the fact that I'm there eight days a month with patients, I read over and over, we need people. So I applied, never heard back.
Terrific. Well, we want to end this meeting by 8, so I suggest that we keep moving on,
Okay.
if that's all right with everyone. So the next item on our agenda is the question of our committee goals for 2026 and how we might want to spend some discretionary funding that the community board has as a whole. So I'm going to share my screen for a moment, and hopefully we'll have a lively conversation. Can everyone see my screen?
Yeah.
Yep.
Okay, perfect. I'm going to present it. Let's see, play from current slide. Here we go. So as discussed at our January 6th full board meeting, the executive board anticipates that we will have a budget surplus of more than $10,000 for the current fiscal year. And the executive committee has requested that we make some recommendations on how these funds could be put towards meaningful and tangible use before June 30th. Alex and the rest of the executive committee have expressed interest in directing the funding towards something regarding street homelessness. And I would like to put forward, of course, consulting with Hayden. He and I have both spoken, and I've spoken with a number of you as well. Two projects that I think would have a inspiring impact in our district. The first is creating a new volunteer-run street homeless outreach program in the community board. And the second is providing some seed funding for one house of worship to open a shelter within its space. So I'll walk through both of these and we'll be happy to answer any questions. And we'll have a set of resolutions that we could vote on this evening or come back to before the general board meeting next week. So the street homeless outreach proposal. It's worth starting with the fact that the current models of street homeless outreach are limited for a number of reasons. People primarily choose to stay on the streets because they feel safer on the streets than they do in the shelter system. The shelter system is rife with theft and violence, and people simply feel safer staying on the street. And outreach teams, meanwhile, are prohibited from engaging in certain activities that might be conducive to them building relationships with people on the street. Outreach teams are not permitted to give food to the people that they engage. And they are often inherently met with skepticism because they wear uniforms and they drive vehicles that have insignia on them that indicate that they're on official business. So the street homeless outreach proposal that I have envisioned, and there are a number of programs similar to this in the city that I've drawn some inspiration from, namely the Street Homeless Advocacy Project, which has been going on for about 4 years now, led by Mark Greenberg and Norm Siegel. Our outreach proposal aims to build relationships with people on the street, not to convince them to enter into shelter necessarily, although over time we hope that that will happen, but simply to build relationships with people that are very vulnerable and often go unseen. So what I envision is breaking our community board into 5 distinct sectors, all from Riverside Drive to Central Park West, one sector from 59th Street to 69th, 70th to 79th, 80th to 89th, 90th to 99th, and 100th to 110th. And each sector would have a designated leader who would be responsible for assembling and leading a group of volunteers to prepare and distribute care packages at least once a week, and of course engage in conversation with the people that those packages are given to. And ideally, the way that I envision it is that these sector leaders will be exceptional high school or college students who are interested in perhaps entering into the human service field professionally. So I envision us designating 5,000 of the 10,000 towards the purchase of materials for those care packages, so food, hand warmers, and hygiene supplies, and having these sector leaders lead their volunteers and distribute them on a weekly basis. Sector leaders would be chosen through a competitive application process, which we are all familiar with because our local electeds often have those for exceptional students for a number of projects. And that competitive application process would include an essay and an interview with both Hayden and I and any other members of the committee that might want to join. And we'd give them the title of CB7 Health and Human Services Fellow, and they'd be trained by myself. I'm a professional in the homeless service space, and other professionals in the space on the basics of street outreach, how to be engaging, how to stay safe, and how to build, again, genuine relationships. The expectation would be that they volunteer just once a week. I envision it being on a Sunday, but I think that we could be open to other days of the week. And we would, of course, equip people with the resources they need to give our neighbors on the streets the tools to better their life circumstances. So we wouldn't want things to just end with giving people a care package. We would ultimately want to engage them in conversation and ensure that they are aware of all the services that may be available to them. So what that looks like to me is connecting directly with the Department of Homeless Services and professional outreach teams like we have with Goddard Riverside and Breaking Ground in the Center for Urban Community Services, and having a direct line to those agencies to say, hey, Joe Smith is interested in entering into shelter today. Could you please stop by and speak with him? So that's the street homeless outreach proposal. I'm happy to take a few questions on that before I move on to the second proposal, which is the House of Worship based shelters. Yes, Louisa.
I'm knocked out by that. I think it sounds fantastic. Are you envisioning these groups to be all high school, college students, or are you opening it also asking members of the community board to be involved?
I would love for, oh, I'm sorry to cut you off.
No, it said something about food, and you said we're not allowed to hand out food.
So that is the city run and city contracted outreach teams. They're not allowed to give people food because of allergy concerns. We live in a very litigious society, as everyone knows. But we would have more agility when it comes to that. Because
Chocobots. Yes.
yeah, exactly. And in regards to the volunteers that we want to engage in the initiative, I envision this being open to anyone that wants to serve. The leadership positions, I think it would be fruitful to have those designated for high school and college students, just for the sake of leadership development and getting people really involved and interested in the space. I will say that, you know, this is actually how I came to homeless service work professionally. When I was a high school student, I began coming into Manhattan regularly from Long Island, and I was distraught to see how many people were in need, and gave people granola bars. When I took a high school gap year, I would make sandwiches every day during my lunch break and then hand them out on the way back from work. And it sparked really a lifelong commitment. So I would love to empower people to take that kind of leadership position. But of course, if members of the community board or just residents in the community board at large want to volunteer, by all means.
It seems to me that it's a wonderful way to get involved with the community, which very often the community board doesn't seem to be able to do. And it wouldn't cost that much money.
No. And we have space also in the office. You know, if people wanted to come over to the office and make sandwiches and put together care packages, I think we would have the ability to facilitate that. And it could be a model for other community boards to do something really tangible. Ken, I saw your hand raised next.
Okay. Yeah, I think it's a really promising, creative idea. I'm just wondering who would supervise them, and also speaking of our litigious society, who would be legally responsible for their welfare?
That's a terrific question. I envision myself supervising these sector leaders. And in regards to liability, I think we would, like any volunteer organization, ask that people sign a waiver that absolves Community Board 7 as an entity from anything that may happen. Pretty much just saying you acknowledge the risks that are involved with entering into this program. Not that I think there are substantial risks, of course. We would never want to put someone in harm's way. But really just getting a waiver and written consent that people are entering into this willfully.
Okay. Yeah, okay. I mean, I've often heard that you can't sign away your ability to sue, no matter what, but everybody does use waivers. But also, seems to be, I mean, we have $10,000. There's no guarantee we're gonna have it next year. Are you seeing this as a kind of a capital expenditure or more like an operating where it would be year to year thing?
So that's more of a question for Alex. I'll definitely defer to him on that.
Well, I think if we can prove it's successful, then we can get more funds. We could expand it. I think it's just a start. I think it's super cool. I think there's some logistic issues that, assuming you guys approve it, that I will then have to figure out with Isaac. But I don't think, in speaking to the borough president's office and other elected, I think it's totally surmountable. And then also about the like who, what other committees are trying or something. I think in general, I'm just encouraging everyone to be proactive. We'll try pass the resolutions if you think this is what you'd like the money to be used for, and then let me try to figure out which of them, how the board decides which gets the money, or if I can scrounge up more money, etc. But yeah, I think you should first think about, do you think this is a good use first, and then we can work on the tactical items.
Thank you for that, Alex. Michael, I saw your hand raised
Yeah,
next.
two quick questions along with the money question. Is 5,000, does that scale for a year of, outreach? If we have, if you have 5 sector leaders and a lot of volunteers, I don't know how, if we are able to meet demand with that amount of money. And then the second question is, we have the Fellows Project that I think was looking at like social service, providers in the area. Does this sync up with that at all? Or have you talked to her? I don't know if she's still, what happened with her, but is she still working on that? And do we have, ways to link this program up with, link the people in this who would get contacted with programs that she looks at?
Yeah, those are both great questions, Michael. I'll answer the second question first. I do see this going hand in hand with the project that Polly is indeed working on. I envision us having a brochure of sorts that lists all the open door services that may be in our neighborhood, and as part of the care packages, those could be distributed to the people on the street. And your first question, I am now blanking on. I'm so sorry.
It's about the sustainability of $5,000.
Oh yes, the
I don't know
sustainability.
how scalable that is, or scalable.
Yeah, I think there are a couple different ways that we could allocate this 5,000. I think if we wanted to designate it towards the materials that would go into the care packages, we could do that. I think we could also look at making this into a stipend for the sector leaders, and then delegating them the responsibility of getting donations to do outreach in their respective sectors and make care packages for those. So I think that the question at hand is really, is this model breaking up the community board into 5 sectors, having a sector leader, and distributing care packages and building relationships, is that a fruitful way for us to spend money? And then I think the question is, within that, what is the best tactical use of the money? Is it towards stipends, or is it towards the purchase of supplies? Madge, I saw your hand next.
Yeah, I don't have a hand raised. Is there any way to integrate this with some of the existing community things like the St. Ignatius program, where we could get people from this program into their program on the way to maybe into shelter? But there are so many existing programs.
Absolutely. And I think that's actually, the objective in the project that Polly is working on. Not to really plug my own organization, and we're north of the community board, but Broadway Community has these little cards that list both in English and in Spanish all the services that we offer. And I think the hope would be that we could convince people to, seek help from places like St. Ignatius, and like Broadway Community and like others in the area. So I do think they go hand in hand. Hope that answers the question.
Yeah, because I think I wouldn't want it to be in conflict with the other outreach program like Goddard.
Of course. Of course. And I think this would be distinct from Goddard in that Goddard is funded through a government contract and there are tight regulations that they need to follow. We would have a lot more agility than they would. Nandita, I saw your hand next.
Yeah, I was just curious. I remember seeing on the presentation the number of people that you were looking for and ways that we could get those, have access to those high school students or college students in terms of like, do we already have those networks to like pass out flyers and kind of spread the awareness, etc. Or is there anything that we would need in order to help drum up support?
Yeah, I think that's a great question. I think we could certainly advertise through the Link NYC kiosks. All the schools in the district, of course, we could market this to. And at Columbia University, which of course is north of the district, but still a lot of the students live in the district, there is the so-called Housing Equity Project, where students for, I think, 40 plus years have been doing some outreach and some staffing of shelters. And I think that they would happily serve as district leaders.
All right, cool.
Shelley, and then Sarah Lee.
I think we might consider working with 3 sectors and not all the sectors to begin with, so that we can see how it develops and make sure that it's a solid program. Because I think doing all the sectors is going to be hard, for anybody to supervise and to keep up with. That's one thing. The other thing is, having had extensive experience with street homeless, very often they don't want to, for a year or more, accept what's available beyond that help. And the people's expectations shouldn't be too high, although shouldn't close any possibility. And some objectives should be set out for what these volunteers should aim at doing, okay? And they're going to need some counseling, because I had people who wouldn't talk to me for the first 5 times, okay? Or take anything from me, and so on. So it's a difficult group to deal with. So, you have the experience, so I'm sure there'll be good guidance there. But I think if we do all the sectors at once, I think it's better to choose 3 and to see the project work. Expanding.
I like that suggestion a lot, Shelley, and I think we can be creative on how we would present a resolution. Maybe we have a resolution for each of the 5 sectors or something, and people could vote on them in tranches. But I really appreciate that suggestion, and I totally agree with you. It's a challenging population to work with, and people need to go in there with accurate expectations. Sarah Lee.
Okay, so the end goal, it's not to house people, is it? It's to befriend them and make them feel comfortable and tell them to go get help.
Yeah.
Get them off the street.
Well, they're not getting off the street with this.
I mean, through building relationships, I think the hypothesis is that building relationships with people, building trust, volunteers will then be in a position to encourage people to accept help. Oftentimes these outreach teams, there's a lot of turnover on the positions, and it's a lot of new faces, but having one consistent face that someone could establish trust with that says, hey, it's really cold outside, you should consider going inside. I could arrange for a car to pick you up, and we could arrange for a single room or a double room for you. Would you be interested in that? It could be very effective. And the SHAP project, the Street Homeless Advocacy Project, has done that very, very effectively over the last 3-4 years.
Yeah, I'm familiar with the project, and it has been effective, but it's very different from this. So I'm just curious, and I can't really participate.
Well, thank you, Sarah Lee. And just being conscious of time, I want to walk us through the House of Worship proposal. And I think after we walk that through, I will defer to the more senior folks on this committee on the best way for us to approach a resolution. And Alex is on the call. Perhaps a resolution isn't even needed to present this to the full board at our next meeting. But that said, I'm going to reshare my screen and excitedly tell you about the House of Worship based shelters. So New York City used to have a thriving so-called emergency shelter network. It was actually a 501c3. I was the board chair of it for 2 years. It's now defunct. And in that network, this is prior to COVID, there were dozens of houses of worship that would provide shelter to people every evening. There were several houses of worship in our own district that were involved in the network. There was Anshe Chesed on 100th and West End, B'nai Jeshurun, Stephen Wise at the Ascension Church on 107th Street. And these spaces, which were colloquially known as respite shelters, got their referrals from drop-in centers, which would thoroughly screen and transport each person to the shelters every evening. And the houses of worship would be responsible for providing volunteers and showers and meals to those people. And the drop-in centers would send transportation for them in the morning. And it was a very meaningful alternative to our city's deeply flawed municipal shelter system. And come COVID, the city ceased all funding for the respite shelter model, and all of the emergency shelter network shut down. In 2023, there was a project that I was deeply involved with the Adams administration, wherein $75 million was designated to create 50 shelters in houses of worship in response to the asylum seeker crisis. Unfortunately, the program never really reached its full potential. Only 13 shelters, I believe, ever came off the ground. The first 3 came off the ground while I was interim director there and holding my current position at Broadway Community. That's a bit besides the point. I share that just to reflect that I am deeply familiar with all of this and very passionate about it. And less than 15, as I said, wound up launching shelters. And that was despite the fact that there were hundreds of houses of worship across the city that were interested in sheltering people in response to the asylum seeker crisis. The funding for that program ended in June of 2025. And currently, this is shocking, there are just 2 houses of worship in New York, in the borough of Manhattan, I'm not sure about the entire city, that host shelters every evening. There's the Broadway Presbyterian Church, where my agency, Broadway Community, is located and shelters people every evening. And there's the Trinity Lutheran Church on 100th Street in Amsterdam, with its partnership with the so-called Trinity Shelter, which shelters 10 people every evening. Those are the only 2 in the entire borough of Manhattan. And we have houses of worship, dozens of houses of worship, hundreds, that are just sitting vacant every evening and that have the ability to shelter people and to provide an alternative to the municipal shelter system. So what I would like to propose, and before I get to that, in June of 2026, I will add, Anshe Chesed, my synagogue actually, and it's on 100th and West End, will be launching a shelter. It'll be the first of the emergency shelter network shelters to come back online since COVID. And my agency, Broadway Community, will be responsible for all of the screening and all of the case management for the 7 men that will stay there every evening. This is important because it shows that this model is viable, and it hopefully will inspire a lot more places to reopen. As I said, there are thousands of houses of worship in the city. There are hundreds in our district, hundreds that were interested across the city in opening shelters back in the 2023 program for the asylum seekers. And what I picture us doing with the rest of the $5,000, or perhaps the whole $10,000 if we wanted to forego the street outreach, is equipping a single house of worship, or maybe two if we went for the full 10,000, with the startup costs to launch their own shelter every evening. So that would include the purchase of cots, linens, hygiene products, and other program supplies. And we would facilitate a partnership with an agency or a group of agencies that could refer people and provide them with thorough case management. I envision us, like the street outreach program, selecting this house of worship through a competitive application process where we consider the congregation's capacity for volunteers, whether they have a shower installed, and whether they're really, invested historically in this kind of work. So that concludes my presentation on this part. Happy to answer any questions. Shelley, please.
Yeah, before the time you referred to, going back 20 and 30 years and more, there was a Beyond Shelter network on the West Side. I think it was 10 synagogues involved. The problem in the long run was city regulations
Right.
that made it very difficult for these institutions without a special, a supervisor, paid supervisor to make sure everything was done a certain way. It became too difficult. I think we have to check into what those regulations are. By the way, Anshe Chesed was one of the Beyond Shelter, first Beyond Shelter synagogues. It's not easy, but these locations were very helpful for people. They served them dinner and served them breakfast, kept them overnight, and that was an answer for many people. But we got to check those city regs to make sure that even if we're doing one or two, don't go off where we are not going to have success.
Absolutely.
Okay.
And I'm pretty familiar with those regulations, but you're totally correct that we will want to consult with our partners at DHS and make sure that everything is kosher. Madge, I think I saw your hand.
Yeah, I volunteered for a long time at the Stephen Wise Shelter, and we used to come there, and it was a wonderful program, but it stopped at COVID. And we were told we couldn't reopen it because of, as Shelley said, regulations, because it was in a basement. They said the ventilation wasn't good enough. And so they've never reopened it. They have cots, they have not even cots, they have Murphy beds with closets, showers, and it's really, was a pretty good setup.
Yeah, thank you so much for that, Madge. And the key sticking point with those regulations was a particular part of the New York City Code called 90104, which says that a shelter over a certain size needs certain fire protection mechanisms in place. And with the asylum seeker crisis, that shelter model envisioned having shelters of more than 15 people. So I remember actually speaking with Stephen Wise and with Sandy at Stephen Wise during that time. And yeah, what held us back was the fact that we didn't have clearance to open a shelter of fewer than 19 people at that time. So my hypothesis, and we'd want to check this, of course, but well, it's not a hypothesis. I know for certain because we're doing it with Anshe Chesed, and it was done for 45 years. But my hypothesis, my strong belief is that if we are under 15 people, we are exempt from those regulations. But to limit liability, I think it would be wise to check anyhow.
That was 10 people.
Yes. It was 10 at Stephen Wise.
Yeah.
Louisa, did I see a hand?
Oh, I think it was kind of answered. I also volunteered. This was at Rodef Sholem. And my only problem with it is that there were probably about 24 guys every night who came on a bus, and they weren't always the same ones. And then they were kind of herded to the bus in the morning. Everyone had to be out by before 8 o'clock. And I think it's a great idea, but I was going to suggest that it should be a smaller group of people, so it could be more of a community. It was had a somewhat barracks feel to it. I don't, Roberta, I mean, is Roberta
No.
not here anymore? Because I know that she's involved with Vote of Sholem. And so it may change. This was a while ago. But
And-
I thought that there were ways that it could have been better.
Absolutely. And we wouldn't want this to be dehumanizing in any way. We'd want to really build community and have people feel comfortable and really feel that they're being treated humanely. And to that end, I think it's worth saying that the model that we have at Broadway Community and that Trinity has is that of a stabilization bed. So what that means is that people are with us 7 nights a week, 365 nights a year, and it's a relatively stable cohort of people, meaning that there isn't too much turnover within that group. So people are able to build community, and we are able to make substantial progress on their housing process, on whatever other goals they may have as well. Alex, I see your hand.
Yeah, one thing I think a huge focus we often, I mean, street homelessness is one of the one or top 3 things that we continuously get into community board as like what is being done, and then a general just absolute frustration. People's perception that nothing is being done. So there's a huge appetite for like, I want to do something, right? And so we're trying to tap into that, say, here's something we could do. I think to your point about the busing and stuff, another big thing I've heard a lot is I want to help the woman I see on 91st and Broadway on the street. I am less interested in someone coming from Brooklyn to the Upper West Side. And I think part of their pitch could be that, like, there's a definite people, I really want to help the woman on 91st Street on Broadway. And this being like, great, we're opening the house of worship and we're focusing on people in the community. So the person is coming 10 blocks over, and then over time, we're working with her to understand and hopefully get her somewhere. So I think that will be very appealing to a lot of people who feel that existing solutions don't address what they want, which is like, I want to help the specific person on Broadway, less some unknown New York City population.
Thank you for that, Alex. And I think we'll maybe take 2 more questions, and then I would love for us to just talk about how we move forward from here. So Ken, I see your hand.
Well, I was gonna sort of move forward. It wasn't really a question. I just think if we're being asked to choose between the 2 proposals, that I would strongly favor this one. I think it's, if we can get 3 people off the street and into housing, not permanent, but just a roof over their head. I mean, I somewhere between 8 and 10 people froze to death in the last 3 days on our streets. And that's worth a lot more than giving somebody a candy bar.
Absolutely.
We were hoping to do both, Ken.
Don't put down candy bars.
But the thing is, I mean, we could do both, but then there's a certain number of people who aren't going to be housed because we're spending $5,000 somewhere else. That's all.
Majesty.
How does the city feel about this? Is Department of Homeless Services supportive of this, and will they help also?
So I have not had a conversation with Department of Homeless Services. Very happy to do that. From what I have heard from some of my partners at Broadway Community, is that the city is increasingly moving away from this model. It was really pushed during the Koch years, and de Blasio really made another push during those years. 2 programs, our program here at Broadway and a program at Rendell Presbyterian Church, were actually reimbursed by the city at a rate of $65 per bed per night, which allowed our program and Rendell's program to hire professional staff. But the program at Rendell closed, and the city, from what I have heard, is not the most hungry for these kind of solutions. But that said, Alex's point is very, very important. All homeless services placement, or all shelter placements in our city, are centralized currently. They all need to go through what's called the Joint Command Center, the JCC. And as a result, we may have a shelter here on the Upper West Side that is contracted with Department of Homeless Services that isn't necessarily serving that woman that Alex mentioned, or that Alex alluded to on 91st. So to have kind of an independent network that we would have oversight over, I think would be really, really valuable.
Yeah, and as it goes to the next steps, I think you should make a resolution. You could just say now, we want a resolution supporting this, or supporting both of these ideas. I think then you should present a full board if that's what you so vote. I think it would be helpful to provide a order of what you think is most important between the two of them. It's not a perfect voting process, right? There are some other committees that will put together some ideas, and I will try to figure out how to allocate between them. But it would be helpful. I think you should have a resolution saying we support these two ideas, if that's what you think. And then between the two of them, we think this is more important than this, or something.
Mm-hmm. That's a great suggestion, Alex. And we are not allowed to have a resolution over email. Is that correct? We need to do it live.
You need to vote live. I mean, you can work on the text over email. You can say the body of the resolution will be the following. Basically, what we're going to say is, here's these two ideas, and we vote to, that the community board should work to fund these ideas. And furthermore, we think that in order of importance, we like the house of worship idea over the other one.
Mm-hmm.
So you can just verbally say that like I did, and then you could have people vote on it. And then over email, you could write that out and say, hey, does this fully capture what we said in the committee?
Terrific. And am I, as board chair or as co-chair, permitted to move a motion?
Yeah. You can say that, or anyone can say it. Yeah.
All right. Terrific. So I would like to move the motion in support of both of these ideas.
Second.
All in favor?
Second. Are we making a distinction right now between which one we favor more, or we think should get more emphasis?
I think we'll do that in a subsequent motion.
Okay.
So all in favor of these two ideas and concept? Okay, terrific. Anyone not in favor? Okay. Any abstentions?
I want to abstain. I don't want to oppose it.
Okay. All right. So I think it carries 7-1-1. And of these two ideas, I'd like to move the motion that the House of Worship project is the one that should take priority over the street outreach project.
Bigger bang for the buck.
Second.
All in favor?
Yeah.
If I abstained on the first one, can I vote on the second?
Absolutely.
No, I meant it doesn't make sense, maybe.
It does.
That's true. I guess
nothing makes sense.
It's fine. Whatever.
Okay, so all in favor, we have 8. Any abstentions? Any not in favor? Okay. So 1 abstention. And Sarah Lee, I think you raised an important maybe not legal note, but logical note rather, because we bundled them together. We said the and, then you're right. It would be contradictory for you to weigh in on this part.
One clarifying question. On the first vote, you had 7-1-1, but that 9 people, or was it 7-0-1-0? There was 1 abstention, right?
Yeah.
On
Yes,
the first one, I abstained.
there was 1 opposed and 1 abstained.
Who was? I think it was just 1 abstention.
No, Shelley
One
did
opposed.
some.
Oh, Shelley opposed.
No,
Yeah, you
No, no,
did.
no.
You had your hand up when we said no.
I think he was frozen. I think he was frozen.
Oh, Shelley, you're for it?
Yes.
Yeah.
I was for it all along.
801 for everybody. Wonderful.
Knowing Shelley's mind, I was somewhat
was
surprised.
shocked.
So that's 8010?
So that was my question.
That's
Yeah,
right.
80. Okay. Yeah, so I think you should draft, Isaac, what you feel like we just voted on, and then send it to everyone saying, does everyone agree this is what we voted on?
Okay.
Well, you got
Cool.
to do non-committee board members.
Oh, so sorry.
Yes, Michael. Are you in favor of?
No, Michael votes with
Michael
us.
can vote.
I vote with the.
But,
Oh, you did?
but we
Okay.
need Alex and Nandita.
Oh yeah, Nandita is on the committee, but yeah, I think
On the
Oh,
committee.
Nandita's on the committee, sorry.
I vote yes too. So you can write Alex. I don't think that matters, but yes. These process,
Yeah.
Okay, cool. Sounds cool. And I think it's an
Terrific.
interesting project. Let's see what happens.
We'll see what happens.
Okay.
So to close us out, do we have any new business? Are there any issues that folks want to raise and elevate? Hayden, I think it is worthwhile for us to mention the joint meeting that we had envisioned.
Yeah, please go ahead. Yep.
So we envisioned for the next Health and Human Services Committee having a joint meeting with transportation, because there are a lot of issues that overlap there. And there's a shelter in the hundreds that is seeking
106.
106 that's seeking a loading zone. And we know that's a bit of a contentious matter, but the dynamic of a human service component I think is worthy of a discussion there. And then of course the issue of safety with e-bikes and whatnot, all of that is very important.
I just note that we haven't absolutely gotten confirmation that they're going to have somebody to send to the meeting, but hope to get that soon.
Yeah.
Mhm.
One other bit of new business, community member Michael Tellis had asked, do you know when the 59th Street shelter is going to commence operations? So I figured we would raise that here now if anyone had the answer to that.
Which shelter?
59th
59.
Street.
The women's shelter.
This
59.
came up in a couple meetings ago, I think, in November.
Yeah, they said possibly by the end of last year, obviously not happening.
Where is it at
But-
59?
It's on
West
across
of-
from John Jay.
Right next to a schoolyard.
We heard a lot about it. Sounds like we don't have a great
They
answer.
came and they talked to us.
Yep.
The board
I will
office
say
would have contact information for the group that presented.
And also our past sessions are all available on YouTube. So our YouTube channel is like CB Manhattan. And we have that session available on there as well. It'll be like a community or a committee meeting session under Health and Human Services. And I believe it's the November one.
They didn't give a specific date, but
So we can certainly track that down.
I'd like to praise our leaders for their chairship.
yeah,
Thank you, Shelley.
thanks for stepping up.
Flattery will get you everywhere. Thank you.
I don't want to go anywhere.
Any other new business? All right.
Motion to adjourn.
That's
Second.
good.
All righty. Well, thank you all so much for your time. Looking forward to seeing you next month and next week for the full board meeting.
Yep.
See you then.
All right, everyone, stay warm.
Really interesting meeting.
Thank you.
Thank you.
You all. Thanks, Isaac.
Good speakers.